House.
Regular daily coronavirus briefing. Begin, as I always do, by thanking you, thanking everybody for all that you're doing to comply with our directives, and thanking you for tuning in. This is by far the best place for you to have accurate, up-to-date, fact-based information about the coronavirus here in the state of Rhode Island. Once again, Dr. Nicole Alexander Scott is not here. I am joined by the fantastic Dr. McDonald from the Department of Health. Nicole has a press conference later today with children, so we gave her a little time off for this press event. Another announcement is that on Wednesday of this week, this press conference will happen at 2:30 instead of at 1 o'clock. So every day this week, 1 o'clock, except Wednesday, 2:30. Today, I'm very sad to say we have another 2 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 27 deaths. We have 160 new cases in the state of Rhode Island, bringing us to a total of 1,082. We have 109 people in the hospital. And soon I'll turn it over to Dr. McDonald to describe the specifics of the cases. I've said all along these numbers are going to continue to go up. They're not cause for alarm. They are certainly not cause for panic. They're very consistent with what we are expecting, and I expect every day for the numbers to continue to increase for many weeks. So we're going to be transparent, but it's serious, very serious. More people will get sick, more people will die, unfortunately, more people will be in the hospital. But this increase is not cause for panic. It's totally consistent with what we've been planning for now for over a month. I want to remind everybody, please use your contact tracing notebook every single day. This is an unbelievable tool to keep yourself safe. We have widespread community spread of the virus. Many of us are going to get sick. So if and when you test positive for coronavirus, the first thing you're going to do once you find out you're positive is I want you to pull out your contact tracing journal. And you're going to hand that to the Department of Health so that they can go through that and figure out who else you've been exposed to in the prior days and weeks. Having done this myself now for the past few days, it's hard to remember every place you've been or person you've been with unless you do it every single day. So please, I'm asking you, everybody, get a notebook and at the end of every day, write down with whom you've been in contact and where you've been. Today, I want to begin this press briefing with some really excellent news. Today is a good day in our fight against coronavirus here in the state of Rhode Island. Earlier today, we announced that we have formed a partnership with CVS to make rapid coronavirus testing widely available. This is a new, free, drive-through testing by appointment only, operated by CVS in conjunction with the state of Rhode Island and the Department of Health in the parking lot of the Twin River Casino in Lincoln. The new rapid testing site, this one site alone at the parking lot of Twin River in Lincoln, has the capacity to test 1,000 people a day. So, and the big news is you will get your result in 15 minutes. So due to this one new site in partnership with CVS, we have quite literally overnight doubled our testing capacity here in the state of Rhode Island. This is a huge announcement. Yesterday I said we were testing just over 1,000 people. And today I'm telling you we can test more than 2,000 people a day in Rhode Island. And the results at the CVS site at Twin River will be given to you within 15 minutes. In fact, you will be asked to wait in your car to get your results right then and there. I have to take a minute to thank the men and women who've made this possible. This has been a very long weekend for those of us who've been working to make this happen. Rhode Island is the first state in America to roll this out in partnership with CVS. Today, we in Georgia went live with this sort of initiative with CVS. I expect other states will follow, but often I'm asked for a glimmer of hope, some good news. People are asking, how are we doing compared to other states? The answer is we were the first in the country to get this out. At 2,000 tests a day, we have some of the highest testing per capita in America. It's due to the fact that CVS is here, headquartered in Rhode Island, has been an unbelievable corporate citizen and partner to me and us from day one. This is just one of a number of things they're doing with us, so thank you to CVS. It's due to the unbelievable hard work and smarts and dedication and around-the-clock effort of so many people on my team. Thank you to the National Guard. Thank you to Ken Brindamore, who's working around the clock on this. Just thank you guys. We had a big weekend this weekend, and I am so proud of you, every one of you who's making it so this could go live today. I want to give you a little bit more information about how this is working. So, and bear with me because I'm going to lay out how all testing is working across the state of Rhode Island. So first, the CVS option. To go get the test at CVS, you do not need to first call your doctor. Go to cvs.com. They have an online reservation system. Go to cvs.com, online reservation system, book yourself an appointment, and then drive to Twin River for the rapid testing when you're told to. You will receive your result in approximately, we'll say, within a half an hour. But as we get up and running, it should be quicker than a half an hour. This site is not for children. You can only go to the CVS site if you're 18 or older. This site really should be used for folks who have to go to work. And it is only for people who have symptoms. So if you have serious symptoms that are consistent with coronavirus symptoms, if you're one of the people who has to work, has to leave the house, and if you're over 18, go to cvs.com, make an appointment, go to Twin River, and you can have this rapid test. Obviously, think of this as like the fast pass, kind of like the easy pass. Not everyone's going to be able to get that, at least not right now. So I want to highlight the other ways you can get tested right now in Rhode Island. We still have testing, swabbing sites, collection sites being operated by the National Guard at CCRI, URI, and Rhode Island College. I want to emphasize the tests that are being done by the Guard at CCRI, RIC, and URI are just as accurate as any place else, as CVS and at the Department of Health. They take longer. Those are being sent out to a commercial lab, and so it'll take a few days by the time we take the swab, send it to the lab, and get the results back. To go to the National Guard sites, you still need an appointment scheduled by your doctor. And by the way, this is where all children should go. So if your kids are sick and you're worried that they have coronavirus, call your pediatrician. If your pediatrician thinks your child should be tested, they will make an appointment with you, for you, at one of the National Guard sites, and you will have the results within a few days. On top of that, we've bulked up our capacity at the Department of Health lab. We're now able to run well over 300 tests a day there, and that number's going up. And we are using that testing for critically ill patients, folks that are in the hospital, people that are in nursing homes, and special situations, because that's a quicker turnaround than sending out to the commercial labs. So just as a recap, if you are a parent of a child and you're worried that your child has symptoms of coronavirus, if you are a basically healthy individual who doesn't have to go to work every day, but you feel that you have symptoms consistent with coronavirus, I need you to pick up the phone and call your doctor, or call your pediatrician, or call a community health clinic, or call an urgent care center. Call them, don't show up, pick up the phone, call the doctor, explain your symptoms, and they will get you to one of the National Guard sites around the state. We'll get you tested quickly, and you'll have your results within a few days, 1 to 3 days. If you are very sick, an adult, have to work, for whatever set of reasons need a fast turnaround, go to CVS.com, get yourself an appointment. In all of these instances, testing is free. Testing is available to everyone, and I don't want anybody to worry about whether or not you have insurance, whether or not you have money in your pocket, whether or not you're an undocumented immigrant. We want you to get tested. We want to keep you safe. We want to keep you healthy. One final thing, the CVS site is for only Rhode Island residents. So big weekend for us. We had a big push, and I'm so grateful to everybody who made it possible. The CVS testing site is a game changer. I'm sure other states will follow us, and thank you to everybody for all you did to make this a reality. A few other announcements. Yesterday, I spoke about Palm Sunday, and again, I'm sorry that all of us had kind of a unusual Palm Sunday. Obviously, I missed going to Mass as much as anyone and not having the palms in my family. This week is Holy Week, and this is going to be another difficult week, and of course with Easter coming up. So I would just ask you, obviously, continue your prayers. We need prayers now more than ever, and continue to be in touch with your parish. I know different priests and ministers are making services available online, through Facebook, by phone. So I would ask you to just stay in touch with one another and stay in touch with your local church. Today, I also want to recognize that this week is the beginning of Passover, which starts at sundown on Wednesday. So it felt appropriate that I address Passover today. And for members of our Jewish community, again, my heart goes out to you. I know this is a sacred, holy, and very special time of year, and a time of year that you would be accustomed to opening your home for big family gatherings, for a larger Seder than usual. Unfortunately, you cannot do that this year. We need to, and you won't be able to go to synagogue for services. So I apologize that has to be that way, but it's necessary to keep everybody safe. So I would just let you know that we are thinking of you and sympathetic to how difficult this will be during this week of Passover. And I would just ask you to really limit the size of the family gatherings, just your immediate family who you're already living with anyway, and be in consultation with your rabbi or your synagogue. I know many of them are going to figure out ways to have Zoom services or Facebook or other postings. A little bit more good news as we deal with the battle against coronavirus. I guess it was just about a week ago, every day seems like one long day, we received the news that the United States Congress had passed a $2 trillion federal stimulus package immediately signed by the president. And I again want to say thank you to our federal delegation, without whom that would not have happened. And special thanks to Senator Rhode, who's been a phenomenal partner to me in all of this. As part of that package, the federal government, the Congress, changed unemployment insurance so that unemployment insurance would begin to be available to workers, to whole classes of workers who typically were ineligible. This is gig economy workers, freelancers, independent contractors, small business owners, hairdressers, a whole category of people in America under the normal set of circumstances are ineligible for unemployment insurance. Late last night, actually very early this morning, we received guidance from the Federal Department of Labor, which now allows us to go ahead and get those checks out. So starting at 8 o'clock tomorrow morning, everyone, including those groups that I just mentioned, can go to the Department of Labor and Training website and file an unemployment insurance application. In addition to that, as part of the federal government's unemployment insurance changes, all workers are entitled to an additional $600 a week benefit from the time of your first check through to July 31st. So let me just take a second because there'll be a lot of questions about this. If you have been laid off due to this coronavirus crisis, I want you to feel confident that you are eligible for unemployment insurance. Even if in the past you have not been eligible for unemployment insurance, maybe you're a hairdresser, maybe you work from home, you're an independent contractor, you are now eligible. And starting at 8 o'clock tomorrow morning, you can go to the Department of Labor and Training website and file for unemployment insurance. Additionally, they will calculate how much you get a week for unemployment insurance according to the formula based upon how much money you've made in the past. They'll calculate that amount. On top of that amount, for everybody, you'll be receiving another $600 a week every week until July 31st. Please note this is only applicable if you've been laid off. If you decide to leave your job, you will not be covered. You will not get unemployment insurance. As you can imagine, we are crushed with demand. And a huge shout out to Scott Jensen and the fantastic team at the Department of Labor and Training. They are just doing unbelievable work trying to process these checks as fast as possible. Every step that doesn't need to be in the process, we're getting rid of. We're getting extra people to help us answer the phones. We're doing everything we can. So thank you to the Department of Labor and Training. You're awesome. But still, we are receiving tens of thousands of requests a day. But still, I'm begging for patience because it could easily take us a week to 2 weeks between when you apply and when you actually get your check. And I would just beg you not to keep calling every day to ask on the status of your check, because if you do that, it's just going to slow us down in getting the checks out. If you haven't heard anything within 14 days, if you haven't received your check within 14 days of when your application is complete, then you can go ahead and check in. So this is good news. It's a bit of relief. It's not enough and not fast enough, but we're doing the best we can. And again, I want to thank everybody for staying strong and staying tough in light of these very difficult economic times. And I want to especially thank all the employers out there who are doing the right thing. So many of you are doing the right thing and keeping as many people employed as possible. And I want to thank you. You're being creative, you're being courageous, you're acting quickly. The name of the game now is speed and flexibility. That's how we are operating. That's how a lot of employers are operating. And I want to say thank you to all of you for your cooperation. So with that, I'll turn it over to Dr. McDonald and then come back to answer questions.
So good afternoon, everyone. And I want to thank you, Governor, for letting me share this information with you. We do have 160 new cases in the state that we're reporting today. Just keep in mind, we're not surprised by this number. This is called case finding. It's a public health strategy. We're trying to find the cases so we can isolate those who are ill, quarantine those who are exposed. So we actually want to find our cases right now. There was over 1,300 tests done yesterday, and thank you to everyone who did those tests. We now have a total in our state of 1,082 cases. There were 2 of us who passed yesterday, and that is very sad. We've had a total of 27 of us who've left with COVID-19. There was 1 person who passed yesterday in their 90s, another one in their 80s. The 1 person in their 90s did live at Golden Crest Nursing Center, and right now there's 10 associated with Golden Crest. Currently, inpatients in the hospital, that means admitted to a hospital right now, there's 109 people. Now, of that 109, 37 are actually in the intensive care unit or the ICU. Of that 37 in the ICU, 26 have a machine breathing for them, a ventilator, so that means they're intubated. So we are excited about the new partnership with CVS. This is very substantial for us, and it's great to be part of this pilot project. There's a little bit of information I want to give you about the data we're going to get. You know, we're going to learn about the positives right away, and the CVS folks have been very nice to work with us. Folks who get tested are getting some educational material about whether they're positive or negative, and we want to thank CVS for working with us on that information. It's very important. It's going to take a while, though, before the negative tests get something we can share publicly. You know, one of the things we have to keep in mind is when we started this response, and just to set context about this, keep in mind 13 weeks ago, COVID-19 was not a known or named disease. So the whole globe has had 1 season of COVID-19. It may feel like longer, but that's what's happened. And right now we're at day 37 since Rhode Island had identified patient number 1. And keep in mind, we started doing all this testing at the Rhode Island Department of Health State Laboratory. So it's really come a long way, I think, really quite rapidly here. So we did build out hospital testing. We have hospitals doing this. The private labs came on board really quickly, and they've been very helpful. But it took us days to integrate those numbers for you as well. So we're just trying to tell you, as we have this new major testing stream, like the governor said, we expect about 1,000 people a day to be tested with the CVS test site. It's going to take us a few days to integrate the negative results into our information. We're just going to ask you to be a little patient with us as we get that data to you. I do want to reiterate a little bit of information that Dr. Alexander Scott shared last week about wearing a cloth face mask when you're out in public. So keep in mind, the cloth face mask is not a medical grade mask. It's just something made of cloth. It covers your nose and your mouth. It can be hand sewn, or it could be a bandana, a t-shirt, or a scarf. Now, for members of our critical infrastructure workforce, this is something you really should be doing all the time. So if you're in the critical infrastructure workforce, and that's really a lot of people who are out there working right now, a good rule of thumb, if you're out there working right now, you probably need to be wearing some kind of covering over your nose and mouth. Folks who are firefighters or people in law enforcement, people who are in the manufacturing fields, people who work in the food and agricultural industry, and there's a bunch more. And one of the things I wanted to do is, I don't know if you're like me, but when I get told to do something new, I generally want to do it. But I just wish someone would tell me, how do you do it? You know, what am I supposed to do? So I brought my N95 mask with me today here. Time for a little show and tell, if you will, here. So this is an N95 respirator. I know we talk about these a lot. So we wear these in the hospital so we don't get sick, and we wear these when we're in front of our patients with aerosolizing procedure. It's a little bit different looking than a surgical mask, which I think is what most of us are used to seeing. But keep in mind, when the surgeon's wearing the mask during your operation, they're wearing that so their air that they exchange when they exhale doesn't infect the incision or the environment. So the point of a mask, the cloth covering and the surgical mask, is so that you don't accidentally breathe out, aerosolized particles so you get someone else sick, or on an object. Remember we talked about this yesterday, the little fomites, those little viral particles that stick on the objects we touch. So we want to make sure that when you put the mask on, it's important to cover your nose and your mouth. So I'm putting it on now. Did you notice how hard it was to hear me when I put that on? You put the elastics on, and it fits kind of snugly when you're wearing N95. It takes a little getting used to, and when you're talking, you have to learn to talk a little bit differently. But when you put the surgical mask on or the N95, it should fit snugly, but you really want to cover the nose and the mouth, and then you know you're wearing it correctly, and that'll work just fine for folks. I do want to thank some other folks who have been helping us with their response. Dr. Alan Tunkel is the Dean of Medical Education at Brown, and a number of the medical students have been just so helpful when working us with contact investigations, and there's about 75 more of them helping us. Tomorrow I was interacting with a fourth-year medical student named James Sharfin, and I think it's important that we know there's a lot of people working behind the scenes, volunteering, who are smart people doing great work. And for the medical students that are helping us, I really appreciate what you're doing. I run the state medical board, and I try to represent our profession the best I can all the time. But when you volunteer like this to help people you'll never meet, that is very consistent with the highest traditions of our profession of being physicians. What we do all the time as physicians, we're other-oriented. It's never about us. It's always about what we can do for our patient. And public health is a great way to help people. So I want to thank everybody at Brown, particularly Dr. Tunkel, for all the help you're giving us. And I'll turn it back to the governor. Thank you.
Thank you for the demonstration. And the first question is for you from Michael Bilo of Motif Magazine. Some studies estimate 25% of infected people have no symptoms, and this minority accounts for as much as 60% of community spread. You now recommend testing everyone with symptoms. Will pinpoint isolation and contact tracing require testing everyone else? If so, when?
Yeah, so Michael, a great question. So keep in mind, COVID-19 behaves like other viruses in many ways. We know now that 2 days before you show symptoms, you're spreading virus. Why this is important is, this is why hand sanitizer is so important and washing your hands so much. And it's funny, if you keep wondering why I keep asking people to wash their hands and use sanitizer after you touch a common object, is because this is really, really important. Your question, though, was about when are we going to test asymptomatic people? And the answer is, yes, we would have loved to have done that, but we haven't had the testing capacity to do that, and we're not quite there yet. What we need to be doing right now is testing those with symptoms. And so I just think for folks who are going to the CVS test site, if you're just curious about it and you feel fine, can you be curious about it at home and not go there today? Because let the people who have symptoms get identified. Put yourself in their shoes. If you have symptoms and you don't feel very good, you want to know what you're dealing with, right? So let's think about our fellow neighbor here and say, well, let them have that test today, right? As testing capacity expands even more, we might be able to do something called surveillance. And surveillance means when you just test people of the general population, but we aren't that at capacity yet.
Next question, Governor. Is Rhode Island expediting Medicaid applications? Can residents self-attest to income, and are area hospitals implementing presumptive eligibility?
We're doing our very best to process Medicaid applications as quickly as possible. With respect to presumptive eligibility, nobody should worry about whether they will have to pay for their hospitalizations. In fact, just today on a call with the Vice President and Seema Verma and the administration, it was made clear that the federal government is working to find ways so that everybody, even the currently uninsured, will not have out-of-pocket expenses associated with hospitalizations on account of coronavirus. Exactly what form that will take, they're still figuring it out. There may be direct disbursements of capital to hospitals, a disbursement to the state. So I don't have a perfect answer right now, but I do want everyone in Rhode Island to get the care that they need if they get sick with coronavirus, and not to worry about getting stuck with the bill.
Next question is from Eli Sherman. How many people are currently in your contact tracing database? Is that information destroyed after 14 days? If not, how long will the state maintain it, and how will it be used?
Yeah, so keep in mind, when we do contact tracing and we identify a case, that is called protected health information, so it is covered by HIPAA. So the information is not destroyed after 14 days. I quite frankly don't know how long we keep it, but the only reason we would use it, and the only way we would use it, was for our purposes. In other words, we're not letting it be used for other purposes like research, and it can't be shared with the public. So the information's private and must stay that way. And we care about HIPAA very deeply at the Rhode Island Department of Health. We're here too, right? And we know that our health information is protected and it matters to us as well.
Could you field the next question from Steph Machado of Channel 12? How many positive cases have been retested, such as healthcare workers, and of those, how many were negative?
Yeah, so generally we aren't retesting people. Quite frankly, right now we're going with more of a clinical assessment of how people can return to work. So quite frankly, if you want to return from isolation, as long as you've met that 7-day criteria and you've been without a fever for 72 hours without Tylenol or Motrin and your other symptoms are improving, we let you back in. As long as those conditions are met, that's what the CDC gave us guidance on. There are some folks much earlier in our pandemic response, so we were able to test and get a negative test. But for now, the vast majority of people are not retested. We go with that non-test CDC given guidance. Thank you.
Doctor, can you now explain why the surge is now predicted later towards the end of April and increased death totals seem substantial? This is from John DePietro.
Yeah, I'm really not sure we know exactly when the surge is going to be. And, I hearken back to a saying I had learned when I was in the Navy that soon isn't the time and hope isn't a strategy. This state has a comprehensive strategy with 12 different work streams going very effectively. I am extremely impressed with how this state has come together so quickly with such a comprehensive strategy, and I love the energy I'm seeing with all these work streams. These are people who work tirelessly and do great things. So I don't think we know when the surge is going to come. The main point here, though, is we're getting ready for this surge. There's a lot of great people doing great stuff, getting the hospitals ready for more capacity. You're seeing the alternate care sites come together. I'm very excited about the momentum we have and the direction we're going in.
Next question is from Steve Clampkin of WPRO Radio. We are being asked why hydroxychloroquine is being used as a treatment for coronavirus in Rhode Island, and what have the results been so far?
Yeah, so hydroxychloroquine has been in the news quite a bit as a treatment. And quite frankly, we don't know for sure if it's an effective treatment. And I want to keep that right up front. I want a treatment as much as anyone else does. I really do. I just want you to know, as a doctor, when I have a patient in front of me, it's very reassuring to offer something that makes the person feel better. That's partly why they come to see me. So I really want that. I think we need to be careful, though, about hydroxychloroquine. Dr. Fauci, runs the NIH, have said, look, I'd like to see the science, like to see the evidence. So the Department of Health did issue emergency regulations about 2 weeks ago about how hydroxychloroquine could be used. And we don't have data yet on how successful it's been in Rhode Island. I know that in the inpatients in the hospital, some of them have been given hydroxychloroquine, some have been given remdesivir, and some have been given some other medications. So, kind of where I'm going with this is let the physicians who are attending to their patients be the physicians we know and trust them to be. They'll make the best decisions for their patients. As we get data that we feel confident we can share with you, we will share that with you. Right now, I don't have anything to tell you.
Thank you, Doctor. Next question. Governor, you said you were going out yesterday, and the question from Tara Granahan said, did you find crowds, and what happened? Also, will you join New York's Governor Cuomo and start fining those who don't follow the restrictions? He had said up to $1,000 fine.
Yeah, so I did go out and about. I checked in on 3 or 4 stores and thankfully was pleased with what I saw. So I want to thank you guys, everybody, for trying a little bit harder to not bunch up and get crowded in grocery stores, which is what I checked on. With respect to a fine, I haven't done it yet, but it doesn't mean I won't. My general approach has been to only crack down more if necessary. I don't want to fine people. Well, too many people are out of work as it is. So, but I will if I feel it's necessary in order to keep people safe. So right now, no. But every day, this is a day-to-day, hour-to-hour kind of a situation, and we will adjust. I want to address the question about modeling because I want people to really understand this. Right now, we are developing our own model here in Rhode Island. The folks at the Department of Health, some fantastic data scientists from Brown University, in consultation with the CDC, and we're working on that. We're also having a team at Johns Hopkins validate our model, and we're in touch with the federal government and University of Washington. And there's nothing perfect about it. It's all based upon so many assumptions. If anyone tells you they know exactly when Rhode Island's peak is and what the number of hospitalizations will be at that peak, they're not being honest with you. The reason is because it all depends. The single biggest variable in the model, the single biggest assumption, is the level of effectiveness of our social distancing. So if over the next 2 or 3 weeks, people stay at home, don't go to work unless absolutely necessary, 100% obey the quarantine if you're ordered into quarantine, do not leave your house if you're sick, etc., then our peak will be pushed out and will not be nearly as high. If, however, on a beautiful day, people crowd around the parks, crowd at the beaches, crowd in lines to get your takeout food, the peak will be sooner and worse. mortality will be worse. That's just the brutal reality of this. So I think our peak could be anywhere between, mid to late April and mid-May. But that changes every day. And I'm trying to be as transparent as possible with people. It's all deeply dependent on how much each and every one of us does what we're told right now. And that's each and every one of us. It also depends on us, we at the state, continuing to get better testing, and as soon as people are positive, get them into isolation and enforce that isolation. We have to ramp up our food delivery. So as Dr. McDonald said, we literally have an army of people working around the clock to ready our system. And every one of these factors will influence how bad it is and when it is. But on a call earlier this morning with 50 governors, and if you look at the data from other states and cities that are ahead of us, it is 100% true that the social distancing mitigates the effects of this, which is why we're being so serious about it.
To continue that thought, Matt Allen from WPRO Radio says, can you talk in more detail about the data you are using to determine whether or not people are hunkering down? Are you using cell phone tracking information? Also, did you end up breaking up any gatherings in your travels around the state yesterday?
Yeah, so I did not have to, though I was certainly ready to if I needed to, and I'm going to continue to do it every day. We are using cell phone information. Publicly available information about people's cell phones allows us to track how mobile people are, how much people are moving. And as I said, last time I checked on that data a week or so ago, we were moving too much. The average Rhode Islander was still moving a few miles a day, more than the national average, more than Massachusetts. And so it's just something we have to really crack down on. The state police, local police, Department of Business Regulation are out there every minute of every day checking in on businesses and other areas where people congregate, parks, stores, grocery stores, and every time we find a crowd, we have to make changes. I do want to thank big box retailers and grocery stores. You've been terrific in this, kind of working with us. And every day we come up with new strategies in order to keep people further apart in line. Now we're asking everybody who works to wear some kind of a cloth mask. So thank you. It's hard, and I appreciate all your efforts.
Next question is from Daniel Kittredge. Many Rhode Islanders were laid off more than 2 weeks ago and applied with the state for unemployment compensation at that time. Based on calls we're receiving, people have still yet to receive their first check. What can you tell us about this, as well as funds people can expect to retrieve? And I assume it's from the federal government. The message is cut off at the end.
Okay. So again, we are really trying our best to get checks out quickly. In the past 5 days, we've made an awful lot of progress. We have more people on the phones, more people doing the processing. We've cut some steps out of the process so that we can do it more quickly. If you've been waiting as much as 14 days, I'm sorry, go ahead and check in. You should be getting your check any day now. It is going to continue to take us between a week or two to get you the checks. I would say the volume, to give you a sense of it, the number of people applying for unemployment insurance in any given day today in the state of Rhode Island is 2 or 3 times what it was during a week during the Great Recession in 2009. So our systems are overwhelmed. We're going to get better every single day. I'm going to do everything I know how to do to shrink that 14 days. And I'll just ask you to hang in there with us. And call us or call 211 at the United Way. It will help you with food and necessities to get you over the hump until the checks come.
Next question is from Tony Mendez of Poder 102 FM. Do you know if the CBS service will be available in Spanish?
I assume so, yes. And again, I want to make a special announcement to the Latino community. Please don't be afraid to come to these testing sites. I know you'll show up, they look official, there might be people in uniform, but you're going to be safe. Please come out, get yourself tested, call your doctor. We're going to take care of you. I want you to feel safe, and I want you to know we're going to take care of you. We're going to get you the tests you need and the medical care that you need.
Last question today is from Hannah Dickinson of WPRI. Is there any test to find out if you previously had the virus, if you had symptoms at the time but could not get tested?
Yeah, the answer is yes. It would be a blood test, a serology test, and we are working on, that will be the next phase. So the immediate phase right now is testing everybody who thinks they're positive, getting them into our database, and doing the contact tracing. The next phase of this will be what Dr. McDonald called, more surveillance testing, and then the blood tests broadly available to figure out what kind of immunity we have in the state of Rhode Island. Immunity as a state. We are a ways away from that. We're focused on it now. We're trying to procure the necessary equipment to do that, but it is coming. But I'm not going to say we're going to have it in a week or 2 or 3, but it's definitely what is to come, in the coming months here in Rhode Island with coronavirus.
Thank you, Governor.
Thank you.
Thank you, Dr. McDonald. Take care.
Thank you.
So that concludes today's briefing. Another 2 deaths in the state for a total of 27 now. 109 people currently hospitalized. Major development.